Hi, my name is Ejeffery1014318-hygiene&skincare. I'm an LPN student from Norquest. My number is 1014318, and I'm going to be doing a lab video demonstrating hygiene and skincare. So we're going to be doing a partial bed bath. My friend Alexa here, who gives us permission to have her in the video. And that's yes? Yeah?
Yes, I do.
Thank you very much. Okay, and what we're going to start with is I'll be doing my hand hygiene. I want to make sure I have all my supplies ready as well before I come into a room. I'm going to introduce myself and say hello. I'm Erica. I'm going to be your nurse. I'm going to give you a partial bed bath today. Is that okay with you?
Yes.
Okay. Can I just check your wristband here and your name?
Alexa.
Your last name?
Delaney.
And your date of birth?
June 18th, 1990.
Awesome. Thank you. Okay. How are you feeling today?
Lovely.
No COVID though, right?
No.
Okay. So what we're gonna do first is I'm gonna ask you as well if do you have any contacts?
No.
Okay, awesome. And I'm just gonna move this pillow for you. So I would hold my hand over her head and place a towel here so we don't get anything wet. Normally she'll have a sheet on her, but we're gonna pretend that's gonna be the bath towel that I would lay on. And then I'm gonna place another towel up here as well. Okay, and by starting, we are going to ask, let's just make sure I don't forget anything. Okay, before starting I want to make sure I move the bed to a proper working height and put the bed rail down so it's not in my way on the side that I'm working on. And so first what we're going to do is I'm going to get 2/3 of warm water, and your basin, but that's what we'll use for a washcloth. Okay, I want to just get her to check the temperature, make sure it's okay with her. Can you see that?
That's lovely.
Awesome. Okay, it's probably cold actually. And then I'm going to wrap this up like a mitt. So doing so like this, and make it easier for washing. And tuck her in here, like so. And we're going to just use the warm water and get it wet and drench it and make sure it's nice, it's not soiled. And we're going to start with her eyes. So I'm going to use one corner of the towel here, get that, and get it around here. And we'll use the other corner to clean up everything over here. Now, how do you feel about having soap on your face? No? Okay. So that makes it simpler. We don't have to worry about putting soap in, but we're going to like rinse it out and dry it, and then start off with her forehead. We're going to go down her cheeks, her nose, her mouth and chin, her neck, and we're going to clean up behind the ears as well. And just pull the hair back right there, and then we can dry her off. So we use a towel right here. Okay, now the next step to do as well, we will be doing her chest area. So by doing that, oh, we missed the arm. Okay, so I'm going to make your arm out here. There we go. And rinse and get the water ready for her arm, and just do long strokes from the dextal to the proximal direction. And then we're going to lift your arm up over your head here and just clean through this area as well. And ask her, do you need deodorant? Okay. And I would grab some deodorant, put some on there for her. And then we'll just bring your arm down. There we go. I'm going to do the same on the other side. But I'm just demonstrating one side of her. And so what I'm going to do now, I'm going to get her ready to clean up her chest, and then we'll do her abdomen area. So we're going to pull this down, about down to her, and maintaining her privacy at the same time is very, very important. There we go. And we'll fold that down to her pelvic area. And then we'll bring this down here too. And we're going to clean the chest area. And if she was a man, when we're doing the face, I would ask her if she wanted to shave, but she doesn't want me to shave her. So, and then we'll start, make sure we're on one side here and properly doing the long strokes. And then rinse and then dry as well. And then I would do the same on the other side. And now I'm going to be lifting this area up and cleaning her abdomen and any skin folds, her belly button. You don't have any skin folds, don't worry. And then get her belly button and make sure that's nice and dry as well, doing the same technique. Rinse, wash, dry. And now we're going to move on to the one leg here. So we would lift one leg up. Have you noticed that we always make sure that they're always covered where we don't need to be washing? And so we'll be going like this, long strokes. And we'll make our way up to her feet. And make sure we clean those toes and ask too if they need to be trimmed. Would you like them cut? No? Okay. And then we're all done. And then we'll dry her leg off. And we'll do the same thing to the other leg. And when we're done, I'm going to, once I was done on both sides, I would ask you to, we're going to roll you over, okay? By doing that, we're going to have this leg just kind of pumped over a little bit like that. And you can move your arm, we'll put this down here. Just bring this all over. And this arm goes over here. And you just do a little roll. Thank you. Awesome. So what we're doing here is we're going to rinse it, dry, like rinse it out, wash her back by doing long strokes all the way down to the buttocks. Okay, and then keep her dry. Thank you. You can roll over. During a partial bed bath or bed bath as well, we would work on her perineal area, and by doing that, she's a female, so I would be working with the skin and labia and cleaning everything around there as well. By maintaining her privacy, we would always have it so she wouldn't feel exposed while we're making sure everything's clean. Same thing for the men as well. And we would also, for the Braden scale, while I was cleaning her, I'll be checking her pressure areas as well, which would have been like up around here, her bones here. I would always be checking her feet where, around this area and here. And when she was on her back, obviously back here, the bottom of her shoulders, top of her bum right here. And you didn't seem to have any tenderness or anything. She would be in the good numbers for the Braden scale. That would be shown no impairment or rarely moist. She was warm, naturally dry. She walks frequently. She just got out of surgery though, so it would be no time. And no limitation. She moved over for me with lots of help. So excellent. And I want to thank you. We would, when we're done, we would make sure she gets her, I'll take the towels off, get her new sheet underneath there, let her air dry for a few minutes, 10 to 15 minutes to air dry. And then we'll change this off here, give you a pillow back, make sure you have new PJs on. And yeah, that's it.